Welcome everyone to the Canadian Nurses Association's webinar series, Progress and Practice. This webinar is titled Workplace Mental Health, Leave of Absence and Return to Work Experiences in Nursing. The session is being recorded for nurses who are unable to participate today. My name is Aidan Hampson. I'm lead for policy at the Canadian Nurses Association, and I will be hosting this webinar. At the end of the presentation, we'll answer your questions, which you can type into the Q&A box that you see to the right of the slide. We'll address as many questions as time allows. The certificate of participation will be emailed to you along with the link to the recording of this webinar. And now a little bit about our presenters, Ivy Bourgeault and Shamel Sands. Ivy Lynn Bourgeault is a professor at the School of Sociological and Anthropological Studies at the University of Ottawa and the University Research Chair in Gender, Diversity, and the Professions. She leads the Canadian Health Workforce Network and the Empowering Women Leaders in Health initiative. Dr. Bourgeault has garnered an international reputation for her research on the health workforce, particularly from a gender lens. Shamel Sands is a Bahamian registered nurse, nurse educator, and certified manager. She is a doctoral student at the Faculty of Nursing at the University of Alberta. Shamel's doctoral work will examine the influence of individual factors, contextual factors, and well-being on Bahamian nurses' turnover intentions during the COVID-19 pandemic. Over to you, Ivy.
That's great. Thank you so very much. So just the next slide, Elizabeth. Thanks so much for the opportunity to present, and Aidan has been a wonderful partner on this project, the Healthy Professional Worker Initiative. So I just wanted to say that the webinar will be undertaken in two parts. I will go through the overview of the partnership, and Shamel will be coming on and describing some of the preliminary findings. And she's been a very, very adept trainee as part of our network, but we're very much colleagues as opposed to just trainees. I also want to acknowledge Abby Ayoub, who is another trainee on the project, who pulled together these slides, and she unfortunately was not able to present in the end due to a head injury that she sustained from an accident. So next slide. So I'm going to start off first by giving you an overview of the Healthy Professional Worker Partnership. Next slide. So we are a CIHR, Canadian Institutes of Health Research, and Social Sciences and Humanities Research Council of Canada funded initiative that examines the experiences of mental health, leaves of absence, and return to work from a comparative perspective and an explicit intersectional gender perspective. Next slide, please. It is comparative in the sense that it involves 7 case study professions, which vary by setting, vary by gender composition, and the issue of leadership is a cross-cutting focus. So I'll first mention within healthcare, we have dentistry and medicine, midwifery and nursing, and we have professions outside of healthcare, academia, accounting, and teaching. But in the academic case, we also include those who are clinical academics. So someone who might be a nurse academic, nurse researcher, physician academic, etc. So we really wanted to kind of understand impact of setting as well. And then, as I mentioned, they vary by gender composition, professions that are traditionally feminine and largely occupied by women versus those that have been traditionally masculine that have only been more recently occupied by women. Professions that we say are feminizing. So medicine and dentistry, accounting and academia are all professions that are traditionally structured as masculine professions that have recently feminized. Midwifery, nursing, and teaching being predominantly more traditionally feminine. Next slide, please. So it involves over 27 investigators and 20 trainees at 16 universities, and the nursing case study is there in pink. So just to acknowledge some of our team members, Sherry Price at Dalhousie University, Melanie Lavoie-Tremblay at McGill University are co-leads, Kelly Lackey at Dalhousie, and Kim McMillan here at the University of Ottawa, they are co-investigators. So in addition to Shamel, we have Kinshara and Abby, who are our trainee partners. Next slide. And our partnership also involves over 30 partner organizations, and some of those are specific to our case study professions, as are in the case of nursing. So we have Aiden with us from the Canadian Nurses Association. She's been a wonderful partner and participant. The Canadian Federation of Nursing Union, Carol Reichert has been our contact there. And also at the provincial level, we have the Nova Scotia Nurses Union and the Registered Nurses Association of Ontario, in addition to a number of other cross-cutting partners like the Mental Health Commission, Statistics Canada, Vanier Institute of the Family, Canadian Institute of Health Information, Healthcare Can, and Health Canada. And all of our partners are sort of switching places, so some people, we don't have a specific identified partner in place. So next slide, please. So I want to go through how it is that we are approaching this research. So what is our conceptual framework and what are our research objectives? Because there's a lot of research ongoing right now about the mental health of nurses. So we really just want to kind of situate ours and what is the unique perspective, in addition to the fact that it is comparison across a number of other professions. So next slide. So I'm going to be going through these, sort of clicking through those. So our contextual model is what we are describing an intersectional contextualized path model of the path is from mental health leaves of absence and return to work. So I'm first going to talk about the intersectional element of this. And this is really building on, theoretical perspectives that emerge out of Black feminist thought. Kimberly Crenshaw, coined the term intersectionality. And we are drawing upon that foundational basis to look at an individual's intersecting identities in terms of their gender identity, again, beyond just a binary male and female, looking at their age, their racialized identity, whether or not they identify as Indigenous, their sexuality and ability. So our survey and our interviews address these different questions. So if we go to the next slide. So we look at all of those intersecting identities on this path between mental health leaves of absence and return to work. And the path doesn't necessarily always go in one direction, and it doesn't only start at mental health. So we wanted to kind of situate this in a cyclical phenomenon. Now, what is contextualized about this is first of all, we look at the individual level. What are the influences of different individual level factors on this path for mental health leaves of absence and return to work? And in turn, what is the impact of what happens in this path on the individual? And if we go to the next slide, we add another layer of context. And this is what is another unique element of our approach, is that we're very interested in the issue of family. And family helps us to get at all of those additional complexities of gender, so that we're looking at gender beyond just gender identity, but gender roles and gender norms and gender relations. Are you the breadwinner of the family? What are your caregiving responsibilities? How does that intersect? What is the influence on this path? And then in turn, what is the impact? And then our next layer on the next slide, we add the element of the work and organizational level. And this is typically where research is done at this element. So again, we want to know, what is it about work that is causing you to have mental health issues? What is it causing you to leave and return to work or not return to work, depending on what that path looks like for you? And then in the next slide, we situate that all within a broader system perspective. So looking at the system and societal level influences and impact. And again, that could be the health system. That could be a system around the gender system. It could be a system around racial identities, racism, etc. So this herein lies, all of the layers that we are looking at, because this is a really complex phenomenon. The decisions, the decisions about what you do with the experiences of mental health. And so we want to try to capture that complexity in the research that we're doing. So we can go to the next slide. So, and you'll see a lot of this stuff is color-coded: red being mental health, green leaves of absence, blue being return to work. So these are our research objectives. So we want to understand the mental health experiences of professional workers, and we want to understand how those experiences are impacted by personal, familial, work, and organizational context. From the leave of absence, we want to identify these personal, work, and organizational, personal, familial, work, and organizational factors that influences workers' decision to contemplate or to take a leave of absence from work, or to not be able to do that. So we're very interested in the issue of presenteeism as well. And we want to identify what are the antecedents that are the precursors to you taking a leave of absence, as well as what are the barriers and facilitators. And the same thing when we look at issues of return to work, to identify the personal, familial, work, and organizational factors that facilitate or create barriers to return to work. And we are particularly focused on interventions that facilitate healthy return to work, but we are also really interested in interventions that focus upstream and improve the mental health context of nurses' work lives. And then impact, we want to understand the impact on a variety of different levels. This path model on the professional workers themselves, the work that they do. So we're interested in issues around safety and quality. We're interested in the impact on clients or students or patients. In the case of nursing, it would be patients, their colleagues around them, their supervisors and managers, and their organizations. But again, it's a two-way street. What is the impact, but also what is the influence? And because we are taking an explicit intersectional gender-based analysis of that, we are looking at how gender influences all of these different levels in terms of gender identity, roles, and norms. Okay, so we'll go to the next slide. So to capture such a complex phenomena of mental health leaves of absence and return to work amongst nurses, we would need a multi-methodological approach. So that is how we are going this research. So if we can go to the next slide. So we have sort of 5 main components, and we're going to be talking about 3 main components today. So we started first with what is it that we know in the literature, because we want to build knowledge, new knowledge. And so we, first of all, did a literature review, and Shamel will bring us up to date about that. There was a very specific focused literature review on return to work interventions, and then that has been updated with more recent. We wanted to talk to different stakeholders that are in unions and professional associations, regulatory authorities, employers, return to work, officers, others in HR. Again, really trying to understand all of the different perspectives on this complex phenomena. So those are stakeholder interviews, and we'll give you some preliminary findings from that. We are in the field with worker surveys and recruiting for worker interviews. So we'll speak to these components. So we'll provide you with a link to participate in the worker surveys. This will be open until the end of the month or Easter, depending on responses. And again, the worker surveys are really trying to capture this whole path and the different layers of context, and also understanding what has been unique in the current COVID context and how that compared to pre-COVID, because many of these issues that we are studying pre-existed the pandemic, and we've been undertaking this research prior to the pandemic as well. But we'll be able to talk about some preliminary findings from the worker interviews. So this really enables us to get at the narrative about those worker interviews. And then ultimately, we really want to focus on interventions. How do we improve this? We don't want to just understand this phenomenon. We are trying to unpack this phenomena, deconstruct it to understand how do we reconstruct it in a way that's much more health promoting for nurses at work. So we'll go to the next slide. And I think at this point, I will pass along to Shamel, who I think has joined us.
Jamel hasn't joined, so you'll need to continue, Ivy, until she
Okay,
does.
all right. No problem. Thanks for letting me know. I'm totally comfortable with these elements. Okay, so first of all, to say that Shamel was part of a team that was led by another one of our colleagues, Christine Koval, that mapped the peer-reviewed literature on accommodating nurses' return to work after leaves of absence for mental health issues. So this was published last year in the International Journal Human Resources for Health. So this is an open access journal, so you could click on that link anytime. So we'll go to the next slide. So the aim of this scoping review was considering the risk factors associated with nurses developing mental health issues. Our team wanted to map this literature to really understand the role of accommodations for nurses return to work after this type of leave of absence. So accommodations are part of that whole package of interventions that we can look at. So the methods undertaken were, a typical scoping review. What was identified were primarily quantitative studies. There were 4 that were published between 1997 and 2018, and most of them originated in the United States, but that is typical of most literature. So qualitative analyses address 3 major themes, and that's sort of what we're going to highlight here. There were alternatives to discipline programs. So this was particularly in the case of substance use issues, which we include under mental health issues. Looking at peer support and return to work policies, procedures, and practices. So go to the next slide. So Elizabeth, I'll just let you inform me when Shamel has come on, and then I'll pass over to her. What was clear from the scoping review is that the literature expressed that these alternatives to disciplines were a much more humane approach to treatment, recovery, and return to work of nurses experiencing mental health issues, and in particular substance use issues, but very little was known about the effectiveness of these programs. This is a general trend, is that there are a number of different approaches that are tried, but very few have been truly analyzed, which creates some space for us in the research that we're going to be doing in the next phase. Half of the literature identified that support from nurse managers and other colleagues are a major facilitator of return to work. And we really want to underscore the importance of nurse managers. And that is why we have, as a cross-cutting initiative across our 7 case studies, a focus on managers or leaders or supervisors, because we feel that this will be a really important point of intervention. Overall, we found a paucity of empirical evidence regarding programs, policies, or practices to support nurses' return to work beyond substance use. And so this, again, is a real gap that we can address with this research. So it clearly identifies the need for the work that we're doing. So go to the next slide. So some of the emerging findings that are coming from our updated literature review, again, taking an intersectional gender lens, is that mental health is very much a gendered experience. Nursing is very clearly a gendered female profession, and that has huge implications on mental health, leaves of absence, and return to work. It affects the way that nurses are treated as a workforce, and that there's a very, very strong pressure for presenteeism, especially for single moms and the high earners in the family. So if you are the breadwinner, the main breadwinner, and that will have changed quite significantly during the pandemic. These are some of the things that we're hearing in our interviews. And so there's also the issue about double or triple caregiving responsibilities. So there's the caregiving responsibilities you have at work. There's the caregiving responsibilities that you have at home for your own nuclear family. And there may be additional caregiving responsibilities for older adults in your family. And so one of the bylines that I always say is gender always matters. So you always have to take it into consideration. So we'll pass over to the emerging findings from those other components from the stakeholder and worker interviews. So we'll go to the next slide and kind of just give you a bit of a sense as to where we are data collection, because we are still out in the field. So we have 11 plus stakeholder interviews. We conducted a couple last week, and we have a couple coming up this week. And so we're doing these in pairs, and I've been involved with that. So we're looking at representatives from nursing unions, associations, regulatory bodies, as well as healthcare authorities and other employers across Canada. So that's who we want to address in the stakeholder interviews. But we're also really want to hear from you as, are there other groups that we should be hearing from? So do let us know. We've got at least 23 worker interviews done. I think that number is a little bit higher since we drafted the slide deck. I know Shamel continues to do interviews. And we're looking across the spectrum. So we're looking at registered nurses, practical nurses, whether they be registered or licensed, psychiatric nurses, if you're out west, and nurse practitioners. So everybody is welcome to participate. And so we'll let you know a little bit about what we're hearing from them. So next slide. So again, red being about the mental health issues. So we're talking about sort of two main issues here. Like, what are the main issues that you're experiencing? What are the main causes? And so we're looking at the whole gamut of mental health issues. This is not just a nurse experience a serious mental illness, but it's going from stress and distress to burnout, overload, and then also getting into more diagnosable categories of depression, anxiety, PTSD, and substance use. So we're really capturing all of those issues. And so we are hearing from nurses that, and in particular, in a post-COVID context, anxiety has really, really risen. Again, we're trying to tease apart the personal, familial, work, and organizational factors. And having participated in a number of the stakeholder and worker interviews, what's very clear is when you ask them, so which of these are the most important factors? What you'll hear with almost not even a nanosecond of a pause, and it's work. It's work related. And then of course that gets complicated by your personal and familial circumstances, but by and large, it's really focused on work. But we're really trying to look at the intersections between work and family and personal circumstances as well. So we'll go to the next slide. So we have a set of questions in our both the interviews and in the surveys, but we don't have any survey response data for you as of yet. Talks about what were things like before COVID? How did this, what were sort of the pre-pandemic circumstances? And again, sort of teasing apart some of the personal factors. Your age, was really important, how old you were, how, so there's stresses associated with being younger and navigating all of the different stressors that you have, but there are also stressors with being older in the profession. So age, arose as a clear issue. And also whether or not there was a history of mental illness, both personally for you or within your family. So those are some of the personal factors that really arose from our conversations. From a familial perspective, marital status, emerged as being really important, and particularly your role within that partnership in terms of whether or not was your income supplementary or was it sort of the primary, and that had an impact on whether or not you felt you could, really take a leave, for example. Notions that we said before about double caregiving responsibilities, kids, and the unique circumstances of being a single parent. And as you can see here, work factors figured quite prominently. And again, these are pre-COVID circumstances. That acuity levels were higher, so patients are sicker. That created heavier workloads, and that was exacerbated by understaffing, so working short. That in addition, you had to deal with very, very traumatic and stressful events at work. There was an overall sense of a lack of managerial support, so here being a really important place for intervention, and that there were sometimes endemic levels of workplace violence, poor relationships with colleagues and managers. And again, all of this was before the pandemic. From an organizational level, it really depended on what sector that you worked in, whether it was, home care or long-term care or acute care. Working in rural versus urban settings had a really important note. There was also noted that even prior to the pandemic, that there was a lack of adequate recognition and support for mental health issues, again, focused really upstream on preventive issues, and a lack of funding to really address some of these. So when we go to the next slide, which addresses what we're hearing during the COVID context, again, the additional stressors that we have there at the personal level was changes in sort of coping mechanisms, right? I mean, you were dealing with a whole variety of issues at the personal level. And the personal guilt that you would feel in terms of calling in sick, this notion of abandoning your colleagues. So this really had a huge impact on the experiences of, the decision-making around nurses to take some time off at work. From a familial level, there was increased stress at home, exacerbated when school was canceled, and an incredible fear, particularly during the first wave, but not insignificant now, of bringing the virus home and all of the different permutations and decisions that would have to be made. And this added additional work to be done to get to work, to come home from work. And then when you got to work, there were even more staff shortages, even heavier workloads. There were exposures to new traumatic and stressful events, and the task took much more time to do. So your ability to be efficient and productive was hampered by PPE, but also just access to PPE and having to use it multiple times, added additional stressful events. And so those were some of the newer events. The trauma of dealing with the deaths that were happening, the incredible illness, and not having any family members be there. So all of the things that we've heard, in the media. From an organizational level, there was just incredible constant changing in protocols and policies. So again, that had the impact of having additional time to get any of this done. And additionally, what was sort of a legacy of the pre-pandemic context was, again, an even greater lack of mental health supports in terms of recognizing the mental health implications of the pandemic for nurses and nursing work. So go to the next slide. So before we even get to the issue of leaves of absence and return to work, we were really curious about, again, what would help nurses' mental health, particularly at work. And so some really interesting issues came up here. So where there were policies, programs, or services, the focus tended to be more on the individual, what they could do, notion of their own self-help and mindfulness and building resilience. And those have a place, that's important, but it should not be the panacea. We're not going to solve the issue of mental health of nurses just by focusing on them themselves. We really do need to take into consideration the work context and to figure out how it is that we make that much more amenable. There was a notion of these incredibly stressful events, both pre-pandemic and during the pandemic, that debriefing sessions are helpful, but they are quite infrequent. And especially now that, everyone's working very short, there's just isn't enough time for this, but they noted that this would be really, really helpful. Others felt that EAP programs, employee assistance programs, where they were accessible And that depended on whether or not you were full-time. But if you were trying to cope with, work overload by working part-time or working casual to have a little bit more control, that was inaccessible to you. And also that they felt that the EAP counselors didn't have the types of cold face or point of care experiences that nurses had to really, really understand what was happening. So having somebody with, the lived experience would be really helpful. They felt that managers were not very well equipped to deal with mental health issues. So again, a really important point of intervention, some tools and resources that we could target for managers. And that in general, there was a lot known about mental health around nursing, but not a lot implemented from the findings from different types of reports, whether they be reports, from the CNA or the CFNU or from academics or other government reports, that there was a lot of reports and very little implementation. So very little changed for everybody to be participating in this type of research. And that the pandemic has led workplaces to implement some supports for mental health. And this has been really important and important for sort of keeping people still in the game, check-ins, webinars, different access to apps and that sort of thing. But again, there was a tendency for these types of supports to be a bit more individual focused and resilience focused as opposed to on workplace. So we'll go to the next slide, and I'm just going to check in, Elizabeth, whether or not we have Shamel yet.
Unfortunately, she hasn't been able to join, so you're going to have to wrap up.
No worries. I'll just continue on, and I'll just have you interrupt me when she does. So now we're moving away from just sort of the mental health and the context and what we could do to help with that, and all of that's really important. And then we are really interested in this path again from leave of absence and return to work. And it's not going to be any surprise to anybody on this call that presenteeism is a huge issue. And what are the antecedents to presenteeism or absenteeism? So there's a high prevalence amongst nurses, high rates of sick leave, but also high rates of presenteeism. It's very difficult to take a leave for mental health reasons. And some of that is, again, it's a lot easier, not to say that it's easy, but it's easier to take a leave if it's a physical health issue. A mental health issue, there's a stigma associated with it. There's this notion that it's not real. And so it causes you to feel, very guilty when taking a sick day for mental health, because there's this notion that you're not really sick. And this is remarkably ironic because nurses are one of our primary mental health care providers. And so that's not applied to oneself. And so there's something that really needs to be addressed there. So on the next slide, we talk quite specifically about issues around leaves of absence. And as was mentioned, so is that taking a leave of absence for mental health can be very, very challenging. And here we get at some of the lived experiences of people. The documents, the forms that you have to fill in to apply for a leave require a specific incident. And sometimes with mental health, it's like what we describe as microaggressions. There are these little things that are constantly nagging at you. It's not just one thing. It's the cumulative impact of a variety of small things. So it's very difficult to say what the one incident is, because again, the forms are really framed around a physical injury and that there was an incident like a fall. And so the forms don't really enable you to do that. So they are a barrier in and of themselves. Now, because there isn't a specific incident, it's difficult to prove or justify why you are not feeling well, experiencing mental health issues. This is even more difficult if you are part-time or casual, because you may not have that ability to take a leave. And the stigmatization, as I mentioned before, is real and ironic. And that is something where I think nurse leaders, can really do something, but it has to be integrated throughout the culture. And that support is really dependent on one's manager. And so we have some really positive stories. And we also have some stories where managers have been particularly challenging. And it could be your manager, that could be, the cumulative impact of why you're going on a leave. So in our next slide, we look at issues of return to work, which is also challenging because what we are finding is that nothing happens between the time that you take a leave and you return to work, other than the fact that you are not at work. But work hasn't changed. There hasn't been sort of an update to kind of see how people are doing and how things could change at work when you come back. So that when you come back, work is the same as when you left it. And so herein is where a lot of improvement could happen. So there's nothing really changes in the work when you're on the leave. And often when you come back, there's no progressive return to work. So it's like you're back into the deep end. And especially for mental health issues, it's kind of like, well, you've had your holiday and now you're back and you need to work. And sometimes people feel that they're even punished for having taken a leave because they should be all refreshed and back to work now. So this lack of progressive return to work, whereas you see that if someone has a physical injury, is very, very challenging. Accommodations are really dependent on the employer or the manager. So we don't see any standardized approach to these types of return to work. And it's also difficult to gauge how much time one needs for mental health leave and when it is appropriate for them to return to work. If you're having panic attacks and anxiety, it's really hard without that progressive return to work, taking small steps to return to work about, what's the time one needs. And so the focus of interventions here, again, like they are for mental health in general, tend to be rather individualistically focused rather than the work and organizational context. So this is where, some changes are needed. One of the things that we like to do that we highlight in the next slide is promising practices. So we give our participants a magic wand. And after we've had this conversation and we understand what are all the challenges, but we do try to highlight what are some of the enablers. If we gave you a magic wand and you could do anything with that magic wand, what would be some of the things that you would do? And so these are some of our top 5 issues that came up. And this cuts across the stakeholders and the workers. So first and foremost, this talking more about mental health in the workplace as a means to destigmatize and legitimize and to address this issue is so critically important because otherwise people suffer in silence. And that is really has to be addressed. Some people talked about having mental health days, and they had 2 senses of that. It wasn't just you taking a mental health day individually, but that there be mental health days at work where you would talk about it. So this goes beyond, the Bell Let's Talk Day, but that there would be some type of regular round, on mental health where you address these issues. And that would be a way to kind of, again, shine the light on these experiences that nurses are having. Related to that, having more debriefing sessions and having the space within work to have those debriefing sessions and how important they are, not just for, the mental health of the nurses and the other staff that are involved, in a particular incident, but also, for just learning going forward and issues around better quality of care, attending to better safety, for patients. But you have to have the space for that, right? And where we have lean, implementation, whether it's actually lean or, a variant of lean. If we are so tight in terms of workload and everyone's working lean or working short, you don't have the space for that. So that has to be attended to at the work and organizational level. Having leaves of absence forms that not only address physical injury, but that really address mental injury or psychological health and safety in the workforce, just anything that addresses some of these issues, that you are not trying to sort of fit a square peg into a round hole when you're filling in these forms. And then 5th, providing support and training to managers and leaders about how to support their employee mental health. And we're really looking at, so that's why the scoping review was important to kind of look at those interventions. So I'll go through the next slides rather quickly because it just sort of kind of gives you an update about what our next steps are. We're going to continue with the document analysis. We're updating the literature review. We're going to continue some of the stakeholder interviews. So if you have thoughts about anybody else that we should speak to, whether that's a name or a particular position or organization, let us know. This is why we do these preliminary findings talks. The worker surveys are open until the end of March, and please, please, please participate. We want to hear from you because it's important. We're doing this work in partnership with organizations like the CNA and the CFNU, but we are at arm's length. So the data that we capture will be that much more stronger for advocacy. So if you're going to participate in a survey, participate in ours because it really helps to reflect the complexity of this of your perspectives. And again, we're really, really focused on interventions. Also, we're happy to hear from you in terms of worker interviews. That will be continuing into April, May, and June. And then intervention case studies is where we're going to be focused next, and that will be in the coming year. So if there is something particularly promising, whether it's in Canada or in the United States, if it's something that we can adapt or adopt, please let us know. We're really keen on that. So just in our next slide, this just gives us a little bit more about that we want to hear from you. Sign up today for an interview. There's an honoraria for the interview. They take approximately 40 to 60 minutes. And we do that by Skype or by phone, whatever is most convenient for you, or Zoom. The survey is open until the end of March. It takes approximately 15 to 20 minutes. If you have taken a leave, there are more questions for you, of course. And this is kind of how the survey is organized. We ask you some questions about your profession. We ask about mental health, stress, and work during during COVID. And then we have you try to reflect back a year or more now to prior to COVID. And then we also look at some of your work characteristics. And then we get into a whole section around mental health, leaves of absence, and return to work, our 3 primary outcome variables, supports and accommodations. And then we end off with personal characteristics and family circumstances to get at these issues. So we're being very honest that it takes 20 minutes. If you leave it, you can come back to it. It kind of remembers where you are at, so you don't have to do it all at the same time. And absolutely, we want folks to be able to participate. So just in the next slide, I think we've got some data as to sort of how many responses, and this is very blurry, unfortunately. So just letting you know that across all of the cases, we have over 2,000 responses now, but we've, in nursing, we've had about 554. So you can see where you're at in your provinces. So PEI, we need to kind of get your responses up, Northwest Territories, Nunavut, and Yukon. But in general, we would love to see many, many more responses. The survey is available in English as well as in French, and we'll be doing a webinar in French on Thursday in that regard. So the next slide gives you a sense about how to engage. So these are QR codes in terms of the link to the English survey or the French survey. But if you go to our website, there's a participate button at the top that will link you right to give you a little bit more background information and the links directly to the survey. There's a long consent form, then you agree to consent, and then that gets you into the survey. And it's quite a nicely organized survey in terms of walking you through it. There are also links to the survey on our Twitter and also on our YouTube. And we have a little video that gives you a little bit more background information about the project. So I think that's the last of my slides. And I think that we turn it back to a question or the Q&A. So happy to engage with you. I know that Aidan has some initial questions, but please post those. We're really keen on getting your questions and feedback. Thanks so much.
Thank you so much, Ivy, for that great presentation. As Ivy just mentioned, we'll now start the discussion portion of the webinar. So if you haven't already, please type your questions into the Q&A text box. But prior to this presentation, we actually had quite a few registrants put in some questions. And so I'll start there. the first question is related to strategies. Are there any strategies to overcome or prevent mental health issues in nursing? And also kind of related to that is, how are nurses expected to cope with bullying when it isn't managed in the workplace in a toxic environment?
Yeah, absolutely. So this is what we have been finding in the interviews is that we see downstream the impact on mental health of issues that are not addressed upstream. So, I mean, we could talk about coping mechanisms, and we have some good ideas in the literature. Addresses some ideas there, but the most important thing about how to address coping issues is really to kind of focus upstream on why is it, that we are experiencing bullying and harassment. The really, really important thing is that any instances of bullying harassment be brought to the attention of managers. And when it is brought to the attention of managers, that it is critically important that they deal with it at that time. And these are uncomfortable things to do, but we need to start getting comfortable with being uncomfortable and with these issues and addressing them head on. So we need to equip everybody with, that ability to be an active bystander to address these issues. So again, we really, really want to sort of focus on some of these upstream interventions that may be, individual and focused on work, but are something that, can help to create a culture that's more amenable to sort of positive mental health for nurses. Yeah, so thanks for that.
Perfect. And we just had a question come in from the Q&A box. I'm wondering if you are taking surveys or interviews for nurses who are off work before the pandemic for mental health issues.
Absolutely. Yeah, this is not related to mental health issues related to the pandemic. Yes, we absolutely want to address anybody who has taken some time off. So even if the leave of absence that you took was quite some time ago, we're still very interested in that. And if you've opted to return to work, or if you've opted not to return to work, we're still very, very interested in hearing from you, because one of the other outcome variables that we're including is not just that you've taken a leave. Sometimes people don't take a leave from a position and with the intention of coming back to that position. Some people do, but some people find a new job. They work in a different place, or they decide to modify their job in a way that they can better cope. So they move from full-time to part-time, or from part-time to casual. If they have the flexibility to do that. So nurses are ingenious, and they will figure out a way to just cope with the situations. And so we are interested in all of those various permutations, not just, a very official leave of absence, but if you've left, if you've left work, or if you've left the profession, we're interested in hearing from you. It's really important.
Perfect. Thanks, Ivy. Another question that I know we wanted to get to is, what are the implications of the strategies or decisions for the future sustainability of the nursing workforce?
Yeah, that's a critically important question. And I know a lot of people are losing sleep over that, including me, because we have to support our health workers beyond just, banging pots and pans and clapping hands and, putting up posters and things like that. We have to make work better for nurses. And I'm not a health professional. And this is the thing that I feel that I can contribute to this, is to support the people who are working at point of care. And what we are concerned about is that people aren't going to leave in the middle of a crisis, but they are so burnt out and working beyond the beyond right now, that when it starts to look like things are back to whatever the new normal is going to be, we are going to see people moving from full-time to part-time to casual, or leaving, taking a leave, changing professions, because they have not been treated with the respect that they need to be treated with. And so it's great that we see more applicants to nursing schools. So is that the solution to our problem, is just churn more people through the profession, or actually change the quality of work for people? And again, this is where I think that we can really support managers to support their staff. And I know that managers, are stressed as well. So how is it that we can support them with tools and resources that can then in turn support their staff? We have to sort of find a way to intervene in this path because it's a toxic pathway right now, and it's only going to get worse. And so we need to sort of figure out how to improve upon these situations.
Yeah, absolutely. And we do have another question here about the survey, asking essentially, are nurses do nurses who have left the nursing because of mental illness due to work, are they still eligible for the survey? Can they still participate?
Absolutely. Absolutely. So if you consider yourself a retired nurse or retired from nursing because of that, absolutely, you are qualified to answer the survey, and you are the types of people that we really want to hear from as well. In addition to the folks who are staying and are coping, the folks who have decided to leave, because that's the information that we need to kind of figure out how do we, and we need to give you a magic wand to kind of say, what would have made the difference for you in staying? And that helps us to, again, focus on the interventions. That's our next phase. This is why we decided to do this research, was really about how do we improve the situation. So we, and so some of that may be, language within a collective agreement. Maybe that's where an intervention needs to kind of really focus upstream. Managers, what resources and tools do they need to have? How do we fit into accreditation and performance measures of organizations, something about mental health, really upstream? So these are the ways that we're kind of thinking about this, not again about individual nurses, but we're trying to think of this really from a systemic perspective.
Perfect. And we just have another question coming into the Q&A box. I know we have Brenda Cousins here saying this presentation should be mandatory for nurse managers. And I just wanted to reinforce that this video will be available on our YouTube channel, so it can be shared to your colleagues as well. And we also have a question here from Rosemary Boyle. Does age or experience provide a buffer to mental health stressors in the workplace? For example, do older nurses cope more effectively, or does resilience decrease as we age? So any thoughts on that from the preliminary findings?
What we are finding, so thank you so much for that question, Rosemary. That's a really, really important point. What we are finding, and this is what we're hoping to see in the survey, and if we can get enough responses from these three cohorts that we're thinking of. So there's the early career nurses, there are the mid-career and the late career nurses. And it comes back to the issue about sustainability. What we're particularly worried about is that those nurses who are late career, we feel that they will choose to leave early. And nurses do. They tend to retire before, the typical retirement age of 65. It's a difficult job, right, to kind of maintain that capacity. And so we lose that incredible expertise that they have. So we have to kind of figure out how do we better support nurses that have been in the profession and that, they're in their late 50s, early 60s. We're quite worried about them, that they might leave early. We're also worried about the early career nurses because they're early enough in their career that they would go back, to school and do something different. They would change careers because they haven't sort of, been in a position long enough that they feel that they've invested so much that they should do that. They are also malleable. And that's a trend across a number of professions, not just for nursing, but we were specifically concerned about that. The nurses in the middle are the ones that we feel are going to not leave nursing per se. This is what we predict, but they are going to reduce how much they're working as a means to personally cope with the situation. And so we need to kind of better understand so the more responses that we have to the survey, the better that we are able to look at some of these questions within nursing. So for example, the contrast for the practical nurses, the registered nurses, and the nurse practitioners, the different cohorts. So, from a statistical perspective, you can do a lot of things with 400, but you can't do a lot of really interesting more sub-analyses within the profession. So this is something that we're really keen on looking at more clearly, but yeah, we have to ramp up those survey responses. So anything you guys can do to help, pass it along to friends, that would be wonderful.
All those who registered today, we'll be sharing the links for the surveys in the post-webinar email as well. And I'm just looking here at another question from the Q&A. And talking about how to get this research essentially to those in upper management or administration who are making these decisions. Essentially, the idea that mental health significantly contributes, or having issues with management contributes to our mental health significantly, and not helping with us with issues on the floor that contribute to burnout and nurses leaving the area. So very grateful that this work is being done, but feeling that, you know, management and those who are higher up in that system aren't necessarily hearing that.
Yeah, no, really, really important point. It is the reason why they are partners in this research. So some of our partners are, you know, the organizations that many of the employers work with. So Canadian College of Health Leaders, Canadian Health Leadership Network, Healthcare Can. You know, we're having conversations now with the Ontario Hospital Association. And so how that then trickles down to individual managers. So we want to think of this in a strengths-based approach. So provide them with positive tools and resources. So we want to equip them, but we need to hear from you. What is it that we need to equip them with? And so we are working in partnership with them. And so that's why we're really keen on this, not just being, you know, advocacy research saying, you know, nurses are really experiencing difficulties, which they are. We definitely want to say that, but we want to get to the solution space because we want to make things better for you. And whatever we need to do in partnership with those who can make circumstances better for you, that's what we want to do. We want to give them, you know, easy to implement tools and resources to improve the situation. So yeah, that's our hope.
Perfect. And just have another question here that came from one of our registrants, and wondering if you can speak to nurses returning to work after they've experienced lateral violence and bullying at work and feeling unheard by managers during those incidents. I know you spoke to it a little bit in your presentation as well, but didn't know if you wanted to expand there.
Yeah, absolutely. And lateral violence is absolutely an issue, and we need to name it. We need to identify it. We need to build skills in identifying it and responding to it immediately, because otherwise, if it's not responded to in the moment or very close to the moment in a way that that the person who's experienced the lateral violence feels that they've been heard and that something will change and be addressed, and that the person who is perpetrating the lateral violence to maintain their sense of self and their integrity at the same time, right? Because you can't have just something be totally punitive, because nobody goes to work to become, you know, to express lateral violence. Nobody goes into nursing to ultimately be a bully or to harass. The work circumstances creates this in people. And so we have to, again, focus upstream on changing those circumstances. So you have to have something in a way that addresses the person that has been the quote unquote victim of this or the target of the violence, as well as those who has targeted, and give them a different path, but a path that maintains their integrity going forward, because you're all going to have to work together. You know, if the response is leaving a job, which I appreciate, sometimes you absolutely need to do that. But if we want to sort of figure out how to improve this situation so that you don't have to leave a job or take a leave of absence. So we want to destigmatize taking a leave of absence, but we want to improve the circumstances to ensure that you're not having to do that. So there's some, you know, it's a delicate area, but it absolutely needs to be addressed. And nothing goes away with avoidance. It's like a sexually transmitted disease. Doesn't go away just because you haven't acknowledged that it's there. And I think nurses know that very, very clearly. So we have to apply that to lateral violence and bullying and harassment.
Yeah, that's a great analogy, Ivy. I really appreciate that. We just, in the interest of time, we are going to have to wrap up. There is one question about, how the criteria related to interviews, but happy to forward that to you to respond directly, if that's okay with you, Ivy.
Yeah, absolutely. Yeah.
Perfect. Well, thank you so much for a really thoughtful and engaging presentation. We hope the session, for all those who participated, stimulated your thinking about healthy workplaces. And based on some of the questions and the engagement it clearly has, you can access the recordings of our webinars by visiting CNA's YouTube channel. And again, all those who participated today or who registered for the webinar will get that in the post-webinar email. Our next webinar will be announced shortly. But again, thank you, Ivy, and thank you to everyone participating today, and really look forward to seeing the final results of the research.
Thank you so much.
Take care, everyone.
Bye. Hang in there.